As a regional referral hospital, we provide services to 2.6 million people in the region. We get clients referred to us from all over the region, from 9 districts and 1 city. And we offer quite an array of services. This is a regional referral hospital. It's a tertiary service. So we have very many specializations in different areas. We have specialization in radiology. We have a radiologist. We have pediatricians for the children. We have obstetricians for the adults, the pregnant mothers. We have physicians for the adults. And we also have some specializations like for the bone, for the eyes, and for the ears. And in the radiology subspecialization, we are glad that government has supported us in not so far back past. We received a CT scan, and this CT scan is a bit advanced from the X-rays, and we also offer ultrasound services. For the X-rays, the X-ray was donated to us by the Coffee Foundation, and it's up and running. The CT scan has been functioning until recently when it broke down. It has a table which moves in and out, but this table has broken down, and it's usually serviced by Ministry of Health contractors. So they were called on ground, and they came around recently, and they assessed and said the machine has broken down. It needs a spare part which needs to be imported. So we are still waiting for them to import the machine, the spare part that needs to be replaced, and then we can have it up and running. So this CT scan is at a fee. Because of the high costs of running it, we have guidance from the permanent secretary from the Ministry of Health, and that's Dr. Atwine Diana, who issued out a circular to that effect, that we charge the CT scan between 120 and 200,000. This cost ranges because of the different specialization you can do with the CT scan. There are those who need a dye to be able to understand the conditions they have. Then there are those who don't need a dye, like for example, if somebody gets head injury, you can do a CT scan without injecting a dye, to what we call a contrast. So that's the challenge we are facing, but the machine has really been helpful. It has been helping us a lot. Ministry of Health is aware that the machine has broken down, and its contractors have been to the ground, they've assessed, and they've gone back. However, Madam Honorable Minister, not once or twice do we even do it for free.
Because I was coming to the question that what if there is this person who literally has no money?
We even have records in the private wing. We are literally running on a low budget. We always, because you know this is a regional referral, we have very many highways which you are aware of. We have the one to Sembabule, Chotera, Mbarara, Masaka, Kampala. We have the one to Kalangala. We do get, I mean, the road traffic accidents that occur within the city. So we get quite a number of unknowns who don't have people who can pay for them. And several times we've waived off and done the CT scan for free. And we do keep that record so that we can give you the magnitude of how many free scans we are doing. So we do quite a number of scans for free of charge when the patient is unable to afford. So we have standard procedures usually follow. If somebody is unable to do, if somebody is not able to afford, there are those who are named, but you really assess and see this is a very poor person who cannot afford. So the specialist usually waives off requests, we waive off, and there are 3 officers who accept and review, and we waive off for that patient. Yeah.
How long does this review take?
The review of waiving off, it's immediately.
Well, it's officers review.
No, we have different people who countersign for the specialist, and then we do it for free.
The other concern was if the government CT scan is high end, and that's why people pay that fee for maintenance, when it's down, they send them to other hospitals, Chitovu, Biansi, and other facilities. You mean they also have the same, or they have other scans?
It's the same machine. It's the same CT scan machine. Ours is the most subsidized. In private setting, the cost is usually higher, and we tend to work on so
So
many
what I'm
people.
saying is, like, I mean, why I'm concerned is if you keep sending them to the other people who do the service at about 250 and 300, theirs never go down. Ours, which is cheaper, is gradually downward. So what could be the problem?
So sometimes it goes down because of the electricity surges, and other times it's because of the wear, the high volume, the high volume of patients we see in our facility also contributes to its breakdown here.
Because at me, I'm thinking the higher volumes are in the privates, because people are always being sent there.
The high
I don't know
volume
if I just show up on bad days, but for all the times I've done impromptu visits, even when I was a senior presidential advisor, I just keep finding people being sent to private facilities.
No, it's unfortunate that whenever you come is where the machine is down, but when services are running and people are getting a service, they are not bound to complain. But when this machine runs down, like I've told you, we receive
Bikadde
and external works, plumbing and electrical, which is left about 6 months to completion. Then we shall go into phase 2, where the ministry and
You
EPDF
need to visit this block houses.
will agree on when to procure those equipment. But in
I think
phase
we
1,
need to push for them to come very fast. The first two is the procuring of the equipment.
that will be phase 2. But phase 1 is about to be completed.
Is the maternity ward that we visited with the Minister of Economic Monitoring when I was still a senior presidential advisor, Honorable Okori, is it ready now?
Yeah,
And mothers are using it?
Yes, we've occupied it.
Oh, okay. That's a good.
Yes, it is functional, although it is also wanting more equipment. Because the project did also have medical equipment on it, it was only the structure which is done. So what we did was to carry the old equipment, but we were also supported by funders like Rotary, which gave us neonatal care unit equipment at the Angola. But again, Ministry also gave us 100 mattresses and some beds, which we put. But the complex is very big. It's
Now
about
that I have you and I have Dr. Senyando and I have director here, what does a mother pay for when they come to give birth?
for general services, they are free, unless a particular medicine is out of stock. That is when they are advised.
Because they swear to me that they are not getting free services. Everywhere I'm
But
going.
the ideal, free services are free. Private services are paid for.
Which are the private services here?
All services, because we have a private wing, that structure you see is purely private. However, there are some services, again, you also offer in private wing free, depending on the availability, because like immunization, we can't charge it. If you're a private mother and you want
What services do mothers usually pay for if they're not in the private wing, if they have not chosen to go to the private wing?
The only things the patients can pay for are one, CT scan. Two, if they have to buy medicine, which is not available here. Apart from that, if they have to buy medicine or utilities, which are not here. But the services, the clinical services, that is the examination, surgery, is free for all mothers. If the investigations are maybe advanced, they are also not available here, like blood tests and everything, those ones they have to go out. But the clinical services, the surgery are free. But like they explained to you, we usually get stockouts. One of the things we have done is to try to have emergency, be prepared for emergencies. But at times you may find sutures are not there, catheters are not there, and then you send the mother to buy. The mother is sent to buy, and then the mother may say the services are not free. Yeah, that is when we have stockouts.
Your stockout usually happens in how long?
maybe before stockout, when National Medical Store delivers medicines, at times the fulfillment is about 70%. Or 78 or 80, meaning that 20% which is not delivered, we always, if that very medicine, for example, in the category
What do you
of
mean the
20,
fulfillment? Meaning what you have?
You make an order. Every month, every 2 months, we have an order. So after every 2 months, NMS is supposed to deliver. So it supplies, and when it supplies, it may not supply all the things that you ordered for that particular order. Either it is they don't have it, or for one reason or another, but they may not fulfill.
They usually fulfill up to what percentage?
Like he has told you.
70 to 80%.
Yeah.
Still,
And that is the normal order per our budget. But as you know, our budget usually is found. The patients we get, the things we need are usually far much more than what we get. So we may have maybe the suppliers, then after 6 weeks, we start running out of certain what?
And what is
the last time we witnessed the delivery of the drugs, you were also here. According to you, they looked like they can.
And honorable, maybe to come in a bit.
I think the last consignment lacked drugs for diabetes and blood pressure, I think. They were not supplying.
Those are common illnesses.
And even drugs for sickle cell.
Yeah.
Drugs for sickle
Sickle cell
cell,
were missing.
even antibiotics.